Welcome to today's lecture on sleep apnea, a common sleep disorder that affects millions of people worldwide. In this comprehensive script, we will explore various aspects of sleep apnea, including its anatomy, etiology, pathophysiology, associated medical conditions, management strategies, and its impact on cardiovascular health. So, let's dive into the intriguing world of sleep apnea. Sleep apnea occurs when there is repetitive partial or complete closure of the upper airway during sleep, leading to intermittent breathing pauses. The architecture of the upper airway plays a crucial role in maintaining its patency. The muscles that surround the upper airway, including the genioglossus, styloglossus, and tensor veli palatini, provide stability and tone to the airway during wakefulness. However, during sleep, these muscles relax, resulting in a more collapsible upper airway. Understanding the intricate anatomy of these upper airway muscles is essential for comprehending the pathophysiology of sleep apnea. Craniofacial abnormalities can contribute to the development of obstructive sleep apnea, OSA, a subtype of sleep apnea characterized by mechanical obstruction of the upper airway. Structural deviations such as retrognathia, receding chin, micrognathia, small jaw, and macroglossia, enlarged tongue, can lead to a narrowed upper airway, making it susceptible to obstruction during sleep. Additionally, abnormalities in the size and shape of the nasal passages, tonsils, and adenoids can further exacerbate airflow limitation. A thorough understanding of these craniofacial abnormalities assists in both diagnosing and managing sleep apnea effectively. While obstructive sleep apnea is primarily a mechanical issue, central sleep apnea, CSA, arises due to alterations in the central nervous system's respiratory control mechanisms. Unlike OSA, CSA is characterized by the absence of respiratory effort during sleep. Dysfunction in the brainstem regions responsible for regulating the respiratory drive, including the pons and medulla, can result in periodic lack of respiratory muscle activation. Various medical conditions, such as heart failure, stroke, and opioid use, can disrupt these neural control mechanisms. Recognizing the unique pathophysiology of CSA is vital for appropriate diagnosis and management strategies. Complex sleep apnea syndrome, also known as treatment-emergent central sleep apnea, refers to a condition where central apneas emerge or worsen following the initiation of continuous positive airway pressure, CPAP, therapy for OSA. The exact mechanisms underlying this phenomenon are still under investigation. It is believed that a combination of residual upper airway collapsibility and altered central respiratory drive contributes to the development of complex sleep apnea syndrome. Early identification and appropriate management are essential in such cases to optimize the treatment outcomes. Obesity is a significant risk factor for the development and severity of sleep apnea. Excess adipose tissue in the upper body region, particularly around the neck and pharynx, can lead to a reduced upper airway caliber. This, in turn, increases the likelihood of airway collapse during sleep. Additionally, obesity is associated with metabolic abnormalities, such as insulin resistance and systemic inflammation, which further contribute to sleep apnea's pathogenesis. Understanding the intricate relationship between obesity and sleep apnea is crucial for comprehensive management approaches. Sleep apnea and hypertension commonly coexist, forming a bidirectional relationship. The repetitive nocturnal hypoxic events in sleep apnea lead to sympathetic nervous system activation, oxidative stress, and inflammation, all of which contribute to the development and worsening of hypertension. On the other hand, hypertension itself can disrupt normal sleep architecture and promote sleep apnea events. Managing both conditions concurrently is crucial to achieve optimal blood pressure control and improve sleep quality. Untreated sleep apnea can have profound effects on neurocognitive function. The fragmented sleep and intermittent hypoxia associated with sleep apnea can lead to excessive daytime sleepiness, impaired concentration, memory deficits, and decreased psychomotor performance. These cognitive impairments can significantly impact a person's quality of life, academic or professional performance, and overall safety. Recognizing the neurocognitive consequences of sleep apnea highlights the urgency for early diagnosis and intervention. Continuous positive airway pressure, CPAP, therapy is the gold standard treatment for sleep apnea. Over the years, significant advancements have been made in CPAP technology to enhance patient comfort and adherence. These include the development of smaller, quieter, and more user-friendly devices, as well as innovative mask interfaces. Additionally, technologies such as auto-adjusting pressure algorithms and humidification systems contribute to optimizing therapy outcomes. Familiarizing ourselves with these advancements empowers healthcare providers to tailor the treatment to individual patient needs effectively. Sleep apnea has profound effects on the endocrine system, leading to imbalances in hormone regulation. Disruptions in the production and secretion of hormones such as insulin, growth hormone, and cortisol can occur in individuals with sleep apnea. These systemic endocrine disturbances contribute to metabolic abnormalities, insulin resistance, and dysregulation of energy homeostasis. Recognizing these endocrine disruptions is essential for comprehensive management to improve metabolic and hormonal health. Managing sleep apnea in special populations, such as pregnant women and the elderly, requires unique considerations. Pregnancy-related physiological changes, including weight gain and increased upper airway edema, can worsen or unmask sleep apnea. In the elderly, comorbid conditions and age-related changes in sleep architecture pose challenges in diagnosis and management. Tailored approaches, including modifications in therapy and close monitoring, are necessary to ensure the well-being of these special populations. In addition to CPAP therapy, several novel treatment modalities are being explored to improve sleep apnea management. These include oral appliance therapy, upper airway stimulation devices, positional therapy, and surgical interventions. Each of these modalities aims to address specific anatomical or physiological factors contributing to sleep apnea, offering alternatives for patients who may be intolerant or non-compliant with CPAP therapy. Familiarizing ourselves with these emerging therapies broadens our armamentarium in managing sleep apnea effectively. Sleep apnea and cardiovascular disease share a bidirectional relationship, with each condition influencing the other's development and progression. Sleep apnea is associated with an increased risk of hypertension, myocardial infarction, stroke, arrhythmias, and heart failure. Conversely, untreated cardiovascular disease can provoke or worsen sleep apnea. Identification and proper management of sleep apnea are vital in optimizing cardiovascular health outcomes. In conclusion, sleep apnea is a complex sleep disorder with multifaceted etiology, intricate physiological mechanisms, and significant health implications. By delving into the anatomical, pathophysiological, and clinical aspects of sleep apnea, we gain a comprehensive understanding of this condition. This knowledge empowers healthcare professionals to make accurate diagnoses, implement appropriate management strategies, and improve the quality of life for individuals affected by sleep apnea.